What's up? It's Way Up with Angela Yee, and I am so glad you're here today. We have Alexis McGill Johnson, the president and CEO of Planned Parenthood Action Fund. Thank you so much for joining me today.
Thank you for having me, Angela. It's good to be here.
Man, when I tell you Planned Parenthood is under attack, I mean, there is just so much going on from news even last week that broke. So, Alexis, I also think it's important, and I know we always talk about this, but we just have to set the groundwork for Planned Parenthood, because I think people just equate like Planned Parenthood is just where you go to get an abortion. And that is definitely not all of the work that Planned Parenthood does. I know, personally, as a person who's been to Planned Parenthood when I was in college, there's so many other services that you guys offer. So can we just break that down for people listening first and foremost?
Absolutely. It is. And thank you for starting with that question, because people do need to understand what Planned Parenthood health centers across this country deliver in terms of care. First off, we are a critical part of the public health infrastructure. Planned Parenthood health centers do not turn away patients, right? Not because of their ability to pay, not because of race, not because of their documentation status, but they are the nation's largest provider of sexual and reproductive health care. So that's everything from birth control, STI testing and treatment, HIV, PEP and PrEP, wellness exams, breast cancer screenings, all of that. And yes, we do provide abortion where it is legal, because abortion is part of sexual and reproductive health care. And we do it proudly, because that is about whether or not people can make their own decisions about if, when, and how they become a parent.
Right. And cancer screenings. Planned Parenthood also does that.
Yes.
Preventative care, education, all of those things that are really important. And it's just interesting to me at a time that the government has decided to defund Planned Parenthood is also a time where healthcare in general is under attack. Those two things are aligning.
Absolutely. I mean, look, I started this job just a few months before COVID. Okay. So I found myself running a healthcare organization, federation, at the beginning of one of the most major disruptions in our healthcare systems, period. And, and I think about, the attacks that have come from all sides. The defund, which we can talk about in a second, that just happened this week, but it's connected to the big bad bill. The Trump administration coming after Title X, which is the nation's largest provider of resources for birth control for low-income communities. They have the Supreme Court has been engaged in cases around blocking Medicaid in states like South Carolina, denying people the ability to choose their own doctor if they are a Planned Parenthood patient. So it is literally every single branch of government coming for us. All the while, literally these people on the ground all across the country are just trying to open up their health centers, serve the people who are right before them, and ensure they have access. Because sometimes Planned Parenthood health centers are the first point of entry into the public health system for a lot of folks.
No, absolutely. And like you said, affordable too.
Yes.
Because you're not turning people away based on finances. So that is something that I feel like one thing that is so broken in this country is the healthcare system.
That's right.
And we compare ourselves to other countries and how behind we are with that. And even as we're talking about healthcare, also, just thinking about abortion did not used to be something that Republicans were so against. And I feel like now is this stance of Republicans are pro-life and not pro-choice, and I feel like that is something that did not used to be the case, but it feels like now that's a talking point.
I think they're pro-power. I think they're pro-control over our bodies. But the reality is, sexual and reproductive health care was a bipartisan issue. It was had a lot of bipartisan support. Some of our health centers across the country were founded by, Republican leaders and supported by many prominent Republican names that, family names that now. The reality is in the 80s and 90s, there was a group of folks who were not actually active in the political process, the evangelical community, and they were trying to figure out, Republicans had lost a few elections in a row, federal elections, and they were trying to figure out how to, what communities were not voting, who could they go out and get organized, and they realized this group was really just not that active, so they went and tried to get them active, see what they cared about. You know what they cared about? You know what they wanted to run on?
What?
Segregation. They did not want to integrate Liberty University. They did not want to, be forced into integrating communities. And they were like, oh, okay, maybe that's
Maybe
not the
that's
way
not the, yeah.
that's not a good look, right? But they, what else is of interest to you? And they started talking about abortion, ending abortion, access to care. And so the alignment between really a movement that was, really grounded in, racism and white supremacy now being aligned with, actively opposing abortion bans and restrictions. And, in some ways, we know these are also the same bans and restrictions that impact Black women, brown women, low-income communities, and rural communities, white women who are also being impacted by this as well.
And let's talk about why that is, because people also need to understand how important access is to healthcare and to family planning.
Yeah.
And so I just want you to break down, why is it that Black women, brown women, lower income families are affected the most?
Well, look, I mean, we live at the intersections of some of the most difficult margins, within our communities. We are marginalized by transportation, access to transportation. We're marginalized in our education systems. We've been, marginalized by our ability to get to a hospital, to get access to care, by the economy, right? So you take all of those kind of marginalizations together and you put healthcare, which is a critical piece of it, at the center. It makes it harder for us to get access to that care. So we know that, Black women are 3 to 4 times more likely to die after childbirth or during pregnancy.
Yeah, Black maternal health care has been a huge issue that I feel like people are shedding some light on now. But then to say, oh, you can't choose your own doctor.
That's right.
Yeah.
That's right. And then you take something like this defund bill. So obviously July 4th, Congress passed and President Trump signed their big, beautiful bill, which I've been calling big, bad betrayal of a bill, which cut Medicaid for so many people in need, right? Medicaid is our largest, insurance provider for low-income folks. For Planned Parenthood, the defund was immediate. Right. So that means that, half of all of our patients are Medicaid patients. And it means that they could no longer come to a Planned Parenthood with their insurance dollars. And for Planned Parenthood, it means that we could not get reimbursed for the services that we provide, just like every other provider. So unlike the bigger Medicaid cuts, which go into effect in 2027, conveniently after the midterms, we had to sue to get an injunction.
I remember you said, see you in court.
Yeah. I feel like I'm always ready. Yeah. Just enough. We going to court. So we went to court. We got a preliminary injunction. And, in the First Circuit, our colleagues in Massachusetts and Utah and the national office on behalf of our other providers, we sued based on, essentially our First Amendment rights, right? Like they came after us politically. They came after us because of our belief that, people's bodies should be their own, right? They should be able to make their own choices. And that is, we were attacked for that, and they withdrew resources from that. So the injunction, we did not win that case. So as of last week, Planned Parenthoods are no longer able to get reimbursed for the services through Medicaid. It's technically a 1-year defund. So we have to, continue to fight in the courts, but also, we know they're coming for more.
So now what happens, right? Let's say somebody comes in and you can't take their Medicaid insurance. What happens to a patient?
So there are a number of states across the country that are going to step in. They understand that their communities depend on their constituents having access to Planned Parenthood, right? So states like New York, states like California have been in conversations with our Planned Parenthood affiliate members there about backfilling some of those resources. So again, it's a 1-year defund for right now. So we've been able to pull together some resources from our state and local governments to help support some of our health centers. But there's no way to cover all of it. Obviously, fundraising to continue to support. I have to say the one thing about working at Planned Parenthood is that we're scenario planners, like professional scenario planners. Right. So we always have like our win-loss mixed scenario, our loss-loss scenario, our apocalypse zombie scenario. Like you never know what is coming at you. And so, we're going to work as hard to see as many patients as possible in Planned Parenthood health centers, and that is what every single member affiliate is doing on the ground. And we're also going to fight like hell politically to make sure that we find a way to reverse this.
Right, because Planned Parenthood also was getting funding from the federal government, correct?
Reimbursements, right?
Reimbursements.
So there's no
Okay,
line item. It's
okay.
not like a Planned Parenthood line item that you can just strike. It's basically just getting reimbursed the way a rural hospital would get reimbursed, or the way NYU would get reimbursed for seeing a patient and then taking their Medicaid insurance.
And so also Planned Parenthood started off with you guys have had to close certain locations as well, right? Certain healthcare centers.
Yeah. So Planned Parenthood is run on the ground. We have 47 member affiliates that cover about 600 health centers across the country. The only national medical service provider across all across the entire country, and that's a mix of health centers and telehealth. And so, 600 health centers over the course of this last year, members have had to make choices to close some to preserve the rest of the care in the state, right? And so what that means is that they're still able to provide care, but it means that the burden is on the patient to travel further. It may mean that they delay getting that care because they've got to make plans to travel across state or, get the time off from work. Or it may mean in many cases that they forego care altogether. And I think that's what we're going to see. We're seeing that at Planned Parenthood. We're definitely going to see that when the Medicaid cuts kick in.
I want to also talk about access to abortion and family planning. What have we seen in the past when abortion has been illegal? Because I think it's not just like having to travel, because that's also a huge hindrance, right? Taking time off from work, also finding somebody who can even take you, because some places that's considered a crime also right now. But people will, if they feel like, I don't want to do this, figure out a way to make it happen. And sometimes those ways are not going to be safe.
Well, look, I mean, we know pre-1973, before Roe v. Wade came down, people were getting access to abortion because at the end of the day, people's determination to live their lives as they wish, as free as they want to, that's always going to be a driving factor. And so, yes, pre-1973, people had some very difficult choices to make. If you had access to resources, you could fly to, out of the country. You could fly, to a state where you could get care. Now things have changed. Medication abortion has actually allowed people to get access to medication abortion in state. There are shield laws that have allowed providers in states like Massachusetts and New York here to send medication abortion to protect the provider so that they can send that medication into states with bans. That is, obviously what's happened since Dobbs is actually abortion numbers have gone up because people have had more access to care, and self-managed care has become, more routine and normalized. So I think that, the frustration from the opposition, right, is that they keep trying to put these bans in. They keep, literally putting our lives at risk, right? Really impacting pregnant women. Abortion bans have made pregnant women pregnancies more dangerous for so many folks. And yet we are still seeking access and getting that access because we understand how we need to take care of ourselves. And they just don't like it. If you're about power and control, and we come in and like, no,
we have a plan B, no pun intended.
I got a plan C, plan B, we got plan C. I got plan. Cis girl over here is going to help me. Like we have the networks, and that's what's happening.
Yeah. And so what is happening with, again, I feel like I've read that access also to getting those at home, medication, the pills that you can take to induce that, that's also something that's being restricted in certain places.
So the opposition is wily, right? They're going to come after access to abortion every single way. So they're coming after Planned Parenthood is one particular way. We have obviously we provide a significant number of abortions in this country, and proud, as I said, proudly so, because we believe abortion is part of sexual and reproductive health care, and we're going to help people in need wherever they are where we can. Medication abortion is also one of those things. So mifepristone and misoprostol, which are the two medications that you take in conjunction to self-managed care, are also under attack. So, we don't know what else is going to come out of this HHS under Secretary Robert F. Kennedy Jr. But we do know that one of the things that's at the top of his list is reviewing the safety of mifepristone, because again, they want to find all kinds of ways to attack access to medication. There are, medication abortion is coming from overseas into communities. Again, it is coming in from states where abortion is legal, because there is need and demand, and people are not going to stop just because some lawmaker says
you're not gonna stop people from having abortions. Right. Here, if that's the intent, and that's what somebody's decision is. I always see the argument too when people talk about this is murder, right? And life begins at inception. What do you say to that?
I say you have a right to believe your own beliefs, right? You don't have a right to impose them on me. And I do not believe that. I believe that people get to make a decision about if, when, how they become a parent. I believe that is a choice that they make between their provider and their and their partner. I believe that they, that they don't get to impose their will, their faith, or what have you on anyone else. And the government's job is to ensure that people have that ability to do that, not to be imposed by someone's religious beliefs on your own decisions.
Why is this such a big deal for them? That's what I understand. It's power, it's control over women's bodies and people's decisions. But I just don't understand why this in particular. I mean, there's a lot of things I'm not understanding right now. But for quite some time, if you don't want to do it, cool. If that's your belief, cool. But why is this something that is I want to prevent people from having access?
Because it's not about healthcare. It's not about saving women. It's literally about control, right? That's why. Because we're in a moment now that is all about the consolidation of power and control. And one of the fastest ways to kind of expedite power and control is to control women's bodies, right? And so we've seen that in every government where there has been a backslide in our democracy or democratic traditions or institutions. The first thing they do is go after women's rights, because it's the fastest way to control half the population.
No, absolutely. When I tell you, I think about kids that are coming up today and the next generation and all the things that they've had to deal with and are going to continue to have to deal with based off of decisions, that are being made. It's just mind blowing to me.
It is. And, in some ways, and I say this as Gen X, I feel like we dropped the ball. I feel like, the assumption that we were always going to be on a forward path and that there wouldn't be backslides and backtracks.
Who would have thought Roe versus Wade would have gotten overturned?
Who would have thought we would be getting rid of affirmative action of DEI?
Right.
Who would have thought, right? The Voting Rights Act would be under such vicious attack. I mean, people built movements and fought for our rights. And, our job was supposed to go and, take advantage of all of the benefits, not necessarily stay vigilant to the fact that they could be taken away. And I think that's really what we need to be telling the next generation.
Yeah, because there's so many things that could have. And what I do think is important is that now people are seeing state by state things that they have to implement and put in place.
That's right.
So that we can still make sure that as individual states, our rights are protected. But just in some states, it's not. It's the exact opposite, too.
Yeah. I mean, I leave here and I go see my mother in Georgia. My daughters are 13 and 16. Literally, we land in Georgia. We have different rights. That's how it works, right? When people talk about states' rights, what they're saying is that in some states you're going to be free, in some states you're not going to be free, because those states, and they're not free because that's where the majority of the citizens in that state believe, because there's no state where banning abortion is popular, where criminalizing providers is popular, where not being able to cross state lines is popular. But they have gerrymandered themselves into power, and they are holding and ruling as if they are, as if they have majority rule. And the reality is, we have to fight back and take that majority rule in order for us to actually have a federal right again.
What would you say to people who are listening right now? I recently just went and got my full exam, but I have been putting it off for so long. Just time, I don't have time,
yes.
And I need to go get my mammogram, and I need to do all of these things that I haven't done.
Yeah.
So I'm trying to schedule things. But what would you say to somebody who's listening right now and they're like, I don't know what to do. I feel like I kind of need to go to the doctor, but it's so much trouble. I don't have health care. Like, whatever their issues are, and they're listening and they're like, dang, I can't even, I don't know how much it's going to be, how much it's going to cost when I go to the doctor. I don't know what health care provider I can go see. Like, I'm just so confused of rights that I had that are now taken away. And what would you tell them? Like, where are some resources? How can they get started in making sure that they're doing what they need to do to take care of themselves? Because I think that's important. Because like you said, a lot of people will be like, I'm just not even going to deal with this at all.
I'm not going to deal with it. But you know, the first thing you can do, you can come to a Planned Parenthood health center. You can get excellent, high quality, trusted care for all your sexual reproductive health care needs, including the men too. We got you too. I think it is so important to ensure that we are keeping regular wellness exams. I can't tell you how many of my friends, particularly during COVID, during that year, when they were being laid off or furloughed, or they weren't sure where their health insurance would take them, and they came back to Planned Parenthood for their wellness exam. So I think a lot of times people think it is just a, like, you know, from, you know, high school to, you know, your 20s. But the reality is, it is, you know, we're here for you through your journeys.
Yes.
The second thing is, I would say that, you know, for all of the care that we need and want, we also have to fight for it, right? I think that's what these last few years have really shown us in great detail, that nothing is ever settled, that if you care about reproductive freedom, if you care about freedom in general, it is so important that we show up in this moment. It's a hard time to show up because it feels like the world just feels incredibly scary and incredibly crazy. But if we show up collectively to engage, to vote, to kind of call your policymakers and say, you know, this is what you want to see, that's actually how power is taken back, like bit by bit. And then the last thing I would say is that you mentioned it, you know, like, we have to be thinking about this in a long term. Like, this is not it's not just a, what do we do today? You know, they had a long time, you know, term plan to, like, to defund Planned Parenthood, to overturn Roe, and we have to be thinking in the same long-term strategies of where do we need to be in the next 15 years? What states do we need to continue to have these ballot initiatives that allow us to, you know, codify our rights back into state by state until we can get back to a federal right?
Have you seen a lot of people stepping up now because Planned Parenthood, as their, you know, Medicaid not accepting, Medicaid's not allowed to, you can't get reimbursed from Medicaid anymore. Have you seen a lot of people stepping up just to donate now, because people can do that too, right?
Yes, I mean, supporting Planned Parenthood, supporting your local affiliate member is so important to ensure that you're continuing, they're staying open in your state. You know, supporting the fight is so important right now, and ensuring that people are able to get access to care. There are lots of people who are stepping in, you know, and I talk to a lot of different kind of constituencies. You know, I would say I was just speaking with a group of corporate women, you know, all C-suite executives last week, you know, and my message to them is like, you know, you would not be in this room but for someone actually fighting for your access to birth control, but fighting for access for abortion, because your ability to move through your career, to go to graduate school, to take the promotion, to, like, you know, fight for where you want it to be depends on your ability to control your reproduction. Like, that's just it. That is about your bodily autonomy, is your self-determination. And so if we are not really instilling that in the people who can afford to give the most, then we're not actually doing our job.
All right. Well, I love that. Well, thank you so much for coming up here. We have really been, like, behind the scenes, like, what about this day? What about this date? So glad that we were able to make this happen at a really critical time. Like you said, the news broke on September 11th about the First Circuit jeopardizing care for 1.1 million Planned Parenthood patients, that defunding has gone into effect.
Yes.
And so it is a really, really critical time. And I feel like sometimes things do slip under the radar because every day there's like a million different things happening.
Right. That's like a strategy. It's like the chaos and confusion and flood the zone. But I really appreciate you lifting this up, because it's going to impact people right now. And they need to understand what's at stake.
Listen, how many people have been to a Planned Parenthood at some point in their life, right?
That's right.
If you think about those numbers, I feel like for women, it's like, what's the number? It's
like 1 out of 3. 1 out of 3 women has been to a Planned Parenthood.
1 out of 3, and men too, like you said.
Yes.
So as well. So just know that this is, like, very critical, very important, very necessary for us.
Thank you, Angela, for covering it as well.
Thank you. Alexis McGill Johnson. She is the president and CEO of Planned Parenthood. Love that you came up here.
Thank you.